TBA. Together again.
Welcome to the clinic, Preparing Your Band for Success, utilizing consultants, mentors, and clinicians. My name is Bernard Rosenberg. I'm the Director of Bands at Tejeda Middle School in San Antonio. I would like to introduce our distinguished panel. Dick Clardy, Director of Instrumental Music, Fort Worth ISD, James Keene, Director of Bands Emeritus, University of Illinois, and Dr. Timothy Rhea, Director of Bands and Music Activities, Texas A&M University. Please understand that we have a limited amount of time for this clinic recording. To make sure to refer to the handout for greater detail, as we will just be hitting the high points. Dr. Rhea, in your opinion, what are some of the benefits of working with a clinician?
Well, first off, we want to thank you, Mr. Rosenberg, for putting up with us here during this clinic today. And I'm honored to be here with my colleagues, Professor Keene and Mr. Clardy. I think that the three of us have had a chance to do a lot of clinic work. And so I think a lot of what we're going to try to share with you today is some of the positive aspects, plus some of the issues that we've dealt with ourselves when we've gone out and done clinics. The first thing about why would you have a clinician, and I think there's several reasons for that. I think one of the greatest reasons is to have a different set of ears. Everybody hears things in a different way and listens for different things. I think bringing somebody new in to listen to your ensemble offers you a totally new perspective. And they can bring your attention to a lot of things that maybe you're not hearing. I did a clinic, I remember several years ago down in the valley with a very, very good friend. We were working on this ending tuning thing, and it was really, really out of tune. And so we isolated. I just turned around and said, "Can you hear that?" And he said, "Well, I can hear it now." So I think a lot of it is we can point things out to our colleagues. It also gives us a chance to learn new or alternative rehearsal techniques. Let's be honest, in our profession, we steal a lot of things from each other. I know everything that I've ever done that has worked, I've stolen from someone else. It gives us a chance to have new approach, new ways to say things. When you're in front of your ensemble and you're saying things the same way every day, a new approach is a good thing. I mean, somebody may know a different way of phrasing something or a different method of doing something that can immediately have a great effect. It can also help you, or as a director, goal setting. What do you need to work on for the future? When the clinic's over, you have a chance to visit with a clinician, and you also want to know what you're doing well, but also what you need attention on, and what kind of time span do you have to fix those things. I think it also exposes you and your students to different styles of teaching and conducting, and it also exposes you to people that have great musicianship and have something to offer to your ensemble. A lot of the people that go out and do these clinics, they've had interactions with the composers that have written many of these pieces. They can add to the background knowledge of the work, the experience that they have dealt with different composers or different levels, lots of things, and their own research that they go through. But overall, I think a clinician not only helps you, it helps your ensemble, offering a change of perspective, but also sometimes by just doing a break in the everyday rehearsal routine. So I think there are many, many reasons, Mr. Rosenberg, that bringing in a clinician can help both you and your ensemble.
Dr. Rhea, so once I've decided to bring in a clinician for my program, what are some items I should consider regarding the invitation to the clinician?
Well, and again, a lot of this is from experience of having done several of these. I would say that the thing that you really want to do more than anything is make sure that you plan far ahead. The sooner that you can contact the person that you're interested in, the better. The really, really good clinicians are going to have very, very busy schedules. And that's a good thing, because by that you know that they're well respected and that they have something to offer. But at the same time, a lot of people, they have their own programs that they're running besides going out and doing clinic work. So you really, really need to get in touch with them early. Before you get in touch with one, you need to make sure that you have looked at the school calendar, because there's nothing that is more frustrating than when you go and half of the bands at a track meet, or you're missing the first two soloists because that they're at the Latin club that was on the calendar, that we didn't check those things. So definitely need to make sure that you've checked the school calendar and has some dates available. And normally it's best if you have more than one date, because as I said, a lot of the people, or if you call Mr. Keene or Mr. Clardy, they're very, very busy people and they have a lot of things on their calendar. So you want to make sure that you give them options, not just they have to come on March the 13th. How do you select a clinician? First off, I think reputation is very, very important. I think it's also important, have you heard their ensemble? Do you want your ensemble to sound like that? What do they have to offer? Or has a colleague worked with this person and maybe you can get some feedback from them? I think it's also important that you find out, is that person, not only are they effective in front of their own ensemble, but are they effective in a clinic setting? There's a lot of people that are really, really fine musicians that have difficulty being really good teachers in front of young people. So you want to make sure that all of that works out. Again, we talked a little bit about having the invitation, everything ready to go, having the dates, no conflicts going on. I really would encourage that if you are going to invite a clinician, do not text them unless they're a really, really good friend of you and you have a great relationship with them. This needs to be a professional contact by phone or email. Plus, there's probably some questions they're going to want to ask you. And that's much, much easier than if you get a text and you're trying to look at your text and a calendar and you can't talk back and forth and ask questions. And I think some of the things that you need to discuss up front with your clinician, first off, is what is this going to cost? What's the fee? And not only is it the fee, what you're paying for is not only the hour or the 2 hours that you're bringing this person in, but the 30 years of experience that they also have that they're getting up and offering to your ensemble and yourself. When I say your fee, you also want to talk about expenses. They can include hotels, meals, mileage, whatever it may be. All those need to be worked out. You also need to tell them exactly what it is they're going to rehearse. Offer them recordings, recent recordings of your ensemble, and a set of scores if they don't have those. And you need to discuss the goals of the clinic. What do you want them to accomplish? Exactly what is the plan for them coming there? Also, the thing that is very, very frustrating is if you walk into a clinic, sit down, you're ready to go, you're thinking about how you're going to approach the ensemble, and somebody hands you a ream of paperwork this big and says, could you fill all this out for me, please? And I need to get it down to the office real quick so we can get you paid before the next 30 days are up. So basically, that is the initial contact. You want to make sure that that first contact is very, very positive and that you are viewed as a very detail-oriented person so that the clinician will be very excited about coming to work with your group. Okay?
Thank you.
Pass back to you. Thank you.
All right, Mr. Clardy, what are the most important considerations to help prepare for a clinician? And from your experience, what is the most forgotten item that would help the clinic be successful?
Thank you for that question. Hey, Bernard, we appreciate you being here tonight and asking these questions. And again, I want to tell you that we have a great list of suggestions on the preparation of a clinic. That's what your question is about. And it's a great checklist to have. So I'll hit on some of those. To me, the overriding factor to have a great clinic in the preparation is that the director students, they need to be receptive and willing to accept new information and the new suggestions from the clinician. So many times ensembles are not prepped on this, and you are in a rehearsal where the students are kind of looking around, what are we supposed to do? So I think that's very, very important. That does not just happen. That comes from a director being very intentional about what the clinic's about, exposing them to maybe the bio and the great things that this clinician can bring to the group. Many times directors are afraid of clinics, and many times those directors are the ones that actually need the clinics. It can be a very humbling experience. If you ever stood in front of a group that you've never been in front of, like in college, and conducted for the first time, it exposes the parts of you that you don't want to show. You lose your comfort. So talking to students about the comfort zone and why the clinician is coming is very important. So if they're not able to accept new information and be cordial and attentive and receptive to that, then the clinician is going to have a harder time. To me, a director should teach their ensemble that any person that he lets into the ensemble room, the rehearsal hall, has been okayed by them, and that they are guests, and any suggestion or thing they say should be respected and taken into account, and it's very, very important. So teaching the ensemble to be open to information, again, just doesn't happen. The director needs to be very intentional about that. And the director is doing this prior. So we want the journey of ideas to be part of the clinic. Attentiveness is responsive and open, cordial, respectful in the rehearsal, really open for suggestions to improve. This is our part of our journey to improve as an ensemble and individuals. I remember there's a really fine director in Houston, and he was at a clinic at TBA or TBA, and he said that he learned vibrato in a clinic that I gave to his band. So you never know what may inspire a student or an ensemble to get better. All right.
Thank you.
The second part of that question, forgotten, I think prioritizing time and making sure that you use that really well during the clinic. And if you're working specifically on one piece, that you leave time to perform another piece to where you can at least get some feedback.
Awesome. Thank you so much. Mr. Keene, is there an ideal time to bring in a clinician? And does the timing affect or influence your goals and expectations for the rehearsal?
Well, for the second part of that, yes, it does. But I want to refer to something that Dr. Ray mentioned, and that was having goals for the specific rehearsal and for the specific clinic and what that's supposed to be all about. First of all, what is the clinic for? Are you preparing a band for contest, for region contest? Are you preparing a band to perform at the Midwest, let's say? Are you preparing a band to prepare a recording for the Midwest? So there's various reasons. I like to think of it, if it's to prepare a band for contest, I don't want to touch that band if it's the week before contest. Hopefully they have the feedback, and it's a matter of polishing from all the good feedback, all the good suggestions and things like that. Something I want to back up to something though, however, and mention something else. I don't like to do just one clinic with a group. I like to set up a minimum of 2 clinics, because I think it takes the group a little while to kind of get used to your tempo, your flow, how you do things, how you conduct, how quickly your rehearsal pace is. So I think it's a good idea to have more than one thing. And the other thing is understanding what I've learned from the ensemble in terms of what their needs are, so that in that second rehearsal, in that second clinic, I can zero in. So ideally, if you can do something, 3 or 4 weeks before contest, come back again 2 weeks before contest, that works very, very well. And so I like to do that. Now, on the other hand, there is another thing in terms of timing. I remember someone one time asked me to come in and do a clinic. And I thought, well, gee, you're bringing me in very early. He said, well, I don't understand this style, and I heard your recording, and so I would like for you to come in and work with us, understanding that we don't have the notes down, we don't have the rhythms down yet, but understanding what we need to focus on what the style of this piece is, and what we should be accomplishing, and also understanding, as Dr. Ray pointed out, that you've worked with this particular composer before. And we'd like for you to share your experiences as we get into the piece. So in that case, it was good to work with a group earlier than that.
Awesome. Mr. Keene, what are a few of the prevalent problems that you consistently encounter in a large number of clinics that you do? And could you please discuss etiquette and expectations of the actual clinic experience?
Well, let me sort of combine both halves of that question. Dr. Ray mentioned before some things, and in your handout, it says in the handout, and I hope you'll refer to the handout as much as possible, because really we're just sort of glossing over the handout as we prepare this. In the handout, we mentioned that one of the good things, one of the great aspects of the clinic is allowing the director to get back and get a little bit different perspective on the ensemble, to get away from the ensemble and hear some things. Now, on the other hand, one of the problems with that is sometimes in the process of that, the directors aren't always focused on that. One of my pet peeves when I'm doing a clinic is for the director to be trying to do a rehearsal, so to speak, within the clinic. In other words, he hears something and he's going over to this section and trying to fix it, and he's doing hand signals and he's trying to fix this and moving around with that. And two things happen. Number one, it distracts the other students. Number two, it distracts me. And number three, I found in terms of post-clinic evaluation that often that director is so focused on the students and their individual parts within that and trying to impress me as the clinician that they're missing the focus of the clinic, and they're missing a lot of the things that we're trying to achieve within the clinic. In terms of some specifics of the prevalent problems I've encountered, consistently percussion present a problem in clinics. You'll see in the handouts that basically insisting that percussion are there, but quite often when we're making a suggestion of mallets, they either don't have other mallets with them or other beaters with them, or they don't have them handy. They've got to walk across the room. In some cases, it's, well, I don't have them, but I've got those kind of mallets at home. I like everybody to have their stick bags, their mallet bags. I'd like to have them right next to them. And also with regard to that focus is quite often the timpani pitch. I almost very seldom do I go into a clinic and where I'm completely satisfied with timpani pitch. And remember that 80% of the timpani parts are matching bass parts in the ensemble. And if the timpani pitch isn't accurate, let's say they're playing a roll in a sustained note with your tubas, with your basses, it's just as if you have a couple bass players out of tune. It's just as bad when that timpani player is not matching. So that's one of the things. And also, speaking of bass players, establishing a fundamental pitch. Quite often, the pitch center, we avoid the fact that we need to focus on having a good fundamental pitch in the bass, and we don't always get that. One other thing that I find is the lack of awareness in terms of who is playing the part with you and identifying unisons and octaves across the ensemble, which is another great aspect, not only of uniformity of pitch, but also uniformity of style, articulation, etc. And the last point that I think I would make with this has to do with one of my other pet peeves, and that is the performance in rehearsal of transcriptions. When I'll find out that I'll say, well, what recordings have you listened to in this transcription? What orchestras have you? Well, I haven't heard the orchestra version, but I heard such and such's band play it at contest last year, and boy, it was great. And so I focused on that, understanding the importance of standard performance practice, of the fact that it is an orchestral transcription, and not only having good exemplary recordings, but also having the orchestral score. So those are some of the prevalent problems that I find consistently.
Thank you, Mr. Keene. Mr. Clardy, what are some reoccurring issues that you have had with directors following clinics? And what meaningful feedback might you have received from clinics?
Well, I agree with Mr. Keene about if you can have more than one clinic spaced apart, that's very helpful, because in the span of 90 minutes to 2 hours or so, it's hard to gauge a group. And that's one of the great things also. You have to be able to gauge the group and make sure that you know your audience. I think the most important aspect, if I were going to make it one single thing, would be the feedback that you give. How consistent are you with the follow-up and specific about things that you saw, the musical and pedagogical problems that you saw from the clinic? I think a good clinician will outline those. First of all, they'll state them to the director. They'll have a little visit with them, and then just a short outline of things that they thought were major items. I did a clinic last year with a group in Dallas, and they were playing march style completely wrong at 6/8, which is hard for sure. So I gave them ways that they could practice that in a consistent way and get that. So pencil, paper, email, and just an open phone conversation. What have you been doing about this? Do you remember that this was a problem? So I think the follow-up and continued follow-up after the clinic is very, very important, especially if you're having a second clinic. Too often this is forgotten by the director and the clinician. So I think that's really, really, really important. I remember as a young band director, I was preparing satiric dances, and I had a clinician come in, a pretty significant person in my mind at that time. And I was afraid to have them in. As I said earlier, sometimes young people, and in fact, the people today are hard. They don't like to have clinicians. They're isolated. It's the new generation. But anyway, the clinic was maybe on a Thursday, and on a Sunday night, this guy called me and said, "I really think the piece you're trying to play," I said satiric dances, "I think you might be able to prepare that another month for Six Flags Festival, but for UIL, I think that's a no-go." So that was sage advice from that clinician, and it did save me. And we went on and we actually won Six Flags with that satiric dances. So I think the follow-up is crucial, and I would encourage any young director to have a clinician and a mentor sooner rather than later.
Well, gentlemen, thank you for sharing your over 90 years of experience of conducting clinics across the nation and internationally. And thanks to all of you for watching this presentation. We hope this clinic was informational and helpful, and we hope that you have a great year. Thanks again for watching.
Thank you, Bernard.
Thanks, Bernard.
Thanks, Bernard. Thanks to all you guys.
Thanks.